Dr. James Pinkney of Diamond Physicians is joining us this morning. We're going to call him Dr. James. Dr. James, thanks for taking the time and joining us. What people are going to notice is that their premiums are going to go up next year. The mandate's going to kick in, and there's going to be some sticker shock, I'm sure. Do you believe that with the new Republican majority as of January next year, that possibly Obamacare can be repealed, or at least have the funding taken out of it?
Yeah, that's a tough question. The law is so intricate, and there's so many different segments woven throughout the law that I don't think the whole thing will be repealed, but I'm hoping that parts will be reformed. Right now, we're having a huge increase in premiums. Some people have seen it rise as much as 300%. Myself personally, with Diamond's plan, has seen a 242% increase, and the law is just riddled with flaws. It wasn't designed to save money. It was designed to improve health, but it doesn't do that either. So America's in a difficult situation.
When you hear, Dr. James, I'm sorry to interrupt you, but when you hear a guy like Gruber suggest that the American voter is stupid and that they had a lie, I mean, let's be honest with what he's saying here. They had a lie. The administration had to lie to us in order to pass this. Were you fooled as a doctor, or did you know from the get-go that this was not going to be necessarily a good thing?
In 2009, I was very optimistic. I heard what the politicians were saying. Obviously, the law itself is several volumes. I didn't read the whole thing, but I took out bits and pieces, and it didn't really make sense to me. So I'm not surprised that everything they claimed is not true. The whole premise was to improve access to health insurance, but that fundamentally does not improve access to health care, which is the most important thing. So I was confused from the beginning and had my optimism went to pessimism very quickly once I realized that no one was accepting the Affordable Care Act exchanges. No physicians were accepting it, and that we were going to have a huge problem on our hands.
Dr. James Pinkney joining us, Diamond Physicians. And many doctors stopped practicing medicine. Retired, just kind of, took the shingle down and said, the heck with it, I'm not going to be involved with this. And then, more patients needed to find doctors that were still practicing. Have you noticed this in your profession? Have you noticed a lot of men or women that you knew that had just said, you know what, I'm done?
Absolutely. Physicians are retiring across the country because they can't keep their doors open, especially in family care. Our margins are very slim. When you have, for instance, a flu test that costs me $13.40, and I submit a claim to an insurance carrier and they reimburse me $4.80, you can't run a business losing money. So primary care was already in trouble, and the Affordable Care Act simply accelerated our problems.
And doctor, just the final question: if you could pick one thing that you would start with, I mean, if this Congress, this Republican majority in Congress, could do one thing with Obamacare, where would you like to see them start? Would it be repealing the medical device tax? What would it be from your perspective that you would like to see them do?
Well, I created a whole new healthcare delivery model at Diamond Physicians that allows access to healthcare. It guarantees access to a doctor where clients pay a monthly fee and receive unlimited visits, no copay, and 24/7 access to their doctor. So I'd like to see them recognize primary direct medicine or affordable concierge as an alternative to health insurance, and let the American people pick what they want. And I guarantee you most people are going to choose direct medicine, the style of medicine that we practice at Diamond Physicians.
Dr. Pinkney, I appreciate your time. Well done, sir. Thank you for joining us this morning.
Oh, thanks for having me on the show.